Welcome to Central African Republic. I'm Bruno Fugah, the country director here. Central African Republic is a landlocked country in the middle of Africa. It is best known for its conflict-affected neighbors, Chad, Sudan, the Democratic Republic of Congo. But Central African Republic has its own story. Let me show you what life is like here. We are on our way to a clinic in Grevai, a remote village 50 kilometers from Merlin's base in Kagabandoro. Luke is one of Merlin's nurse supervisors. He travels to Grevai twice a week to train Ministry of Health workers and to make sure the clinic is running well. Getting to Grevai is a first hurdle for him. This part of the country is relatively stable now, but conflict flares up often. Before our teams travel anywhere, we always have to contact the UN people to find out how the situation looks like when it comes to security and ensure that the roads are safe. We arrive in Grevai just as a clinic for women and children is getting started. These clinics are always busy. Health workers here can see as many as 100 and 150 patients a day. Hard to imagine that when Merlin first arrived, most of the health workers had fled. There were no drugs, no equipment. The clinic had been looted of everything. Now look, many of the children suffer from diarrhea, diseases, malnutrition, respiratory tract infection, and of course, as we all know here, malaria. Now that Merlin has stocked the pharmacy and is running training courses, what's happening? We realize health workers here say they have more confidence in their ability to tackle the common diseases they see every day. But the standard of care remains incredibly low. Even with Luke on hand to supervise, there isn't a qualified health worker in Grevai. Some, like Jean Présid, were first trained 20 years ago. Others, like the clinic matron you see over there, have learned everything she knows through experience. During the height of the conflict in 2006, Grevai was totally deserted. 2 years on, life is slowly getting back to normal. Communities are now playing a key role. Merlin is rebuilding the clinic in Grevai. We are building the first maternity ward as well as inpatient and outpatient facilities. All this work is being done by local people. These are not just buildings for people here. They are symbols that life finally is improving. I always tell communities that we will rise or fall together, that we must all work to make change happen. The health worker crisis in CAR is severe, but Merlin's work shows that progress can be made, that change can happen, and that lives can be saved.